Good morning. Senate Health, Education, Labor, and Pensions Committee will please come to order. Today we are holding a hearing on our nation's growing mental health and substance use disorder crisis. I'll have an opening statement followed by Ranking Member Burr. We will then introduce our witnesses, and after they give their testimony, senators will each have 5 minutes for a round of questions. Again, we are unable to have the hearing fully open to the public or media for in-person attendance. As always, live video is available on our committee website at help.senate.gov. And if you are in need of accommodations, including closed captioning, you can reach out to the committee or to the Office of Congressional Accessibility Services. I hope that everyone on this committee found our hearing in February with mental health and substance use disorder experts, care providers, and advocates to be informative and compelling. We're all hearing from families in our states about the need for action. Parents worried about their kids' well-being after the stress and trauma of this pandemic, people struggling with depression and anxiety themselves and unsure where to go for help, communities fighting a rise in substance abuse, as well as a surge in overdose deaths fueled by a deadly increase in fentanyl use, and mental health and substance use disorder professionals who are feeling overworked, overwhelmed, and just burned out. We all want to address these challenges, which is why Senator Burr and I are working in a bipartisan way on legislation to support our communities and help people get the services for mental health and substance use disorders that they need. We continue to make progress on that effort, and our hearing today represents another important step forward. I spoke last time about the work that Lifeline Connections and Neighborhood House and the Confederated Tribes and Bands of Yakima Nation and other local organizations are doing to address the mental health needs of families in Washington State. And I'm glad to have this opportunity to discuss how the federal government can better support frontline efforts to screen and provide services for mental health challenges, support people who are struggling with substance use disorder, increase access to addiction treatment, prevent drug overdoses and suicide, and more. Because COVID-19 has made it clearer than ever that while our communities are doing valuable life-saving work, we need to do much more to help them. Youth health emergencies have skyrocketed during this pandemic, with sharp increases in kids' visits to the emergency room for mental health crises, thoughts of suicide, suicide attempts, especially among girls. And as of February, over 200,000 children have had their world shattered after losing a parent or caregiver to COVID-19. This pandemic has also set us back catastrophically when it comes to substance use disorders. We saw an estimated 106,000 drug overdose deaths in a single year. That is a record high. And fentanyl has been especially devastating for families in my state. Fentanyl deaths in our largest county doubled last year. But nationally, we're also seeing a concerning rise in methamphetamine and cocaine use. Meanwhile, our mental health and substance use disorder workforce, which was already stretched thin, is nearly threadbare. I said this before, but it really stands out to me that almost 130 million Americans live in areas with less than one mental health provider per 1,000 people. And in my home state of Washington, our mental health care workforce is only able to meet 17% of our state's needs. Meanwhile, nationwide, not even a tenth of people who need treatment for substance use disorder actually get it. And these problems are especially pronounced for rural areas, communities of color, and people with disabilities. And it's important to remember that the many people who are personally facing mental health and substance use disorders or struggling to get the support they need aren't the only ones feeling this. We all have friends and family who are, whether we realize it or not. We all rely on first responders, healthcare providers, and other frontline workers who are experiencing burnout and trauma. We all have a stake in making sure people can get the help they need. So let's make sure we act accordingly. Now, we are starting here on square one. We have a long bipartisan track record of addressing mental health and substance use disorders in this committee. But we're also not close to where we need to be, especially considering the ways this pandemic has worsened pre-existing challenges. We need to rise to this moment by strengthening the tools that communities are already using effectively to help people get care and providing new ones to address the gaps and emerging issues this pandemic has made so much worse. That means putting together a bipartisan package that supports suicide screening and prevention, helps schools and communities meet kids' mental health needs, reduces drug overdose deaths, and gives patients more options to get substance use disorder treatment, addresses the mental health needs of new mothers, tackles barriers that make it hard for people to get the care they need, like stigma, health inequity, and a strained workforce, and more. I know members on both sides of the aisle share these goals and have ideas about how to make them a reality, and I look forward to continuing to work with all of you on this. As Ranking Member Burr and I have announced, it is our goal to pull the committee's mental health package together in early summer so we can move legislation to the floor. We both hope to have more to say on that in the days ahead and appreciate the many ideas that members on and off this committee have for the package as we work together to address this crisis. This pandemic has done so much to damage our nation's mental well-being. There are so many people who are stressed and anxious and traumatized, struggling with addiction, or who are grieving over the loss of a loved one and don't know where to turn. But there are also people in our communities who care about them and who are working right now to get them help. So as this committee works on bipartisan legislation to reauthorize and improve federal programs on mental health and substance use disorder, I look forward to hearing from all of our witnesses today about the steps that we can take to help bolster the efforts of those on the front lines of our mental health and substance use disorder crisis and make sure that every person who is struggling can get the care they need without worrying about stigma or cost, without having to travel for hours or wait for weeks, and without feeling like they're all on their own.